Okay, so I have to thank everyone for being here and introduce the SHAB membership. And
Real quick, let me
okay.
let me do the introduction.
Can I?
Okay.
Go ahead.
Okay. So good evening, everyone. If any of you are different from previous budget presentation. So now we'll hear the student health services budget. Again, it has to be done by a student, and we advise for faculty and staff to be here so they can help answer any questions we have. We have 30 minutes for the budget presentation, and afterwards we'll go into discussion. We'll ask you more questions. During the presentation, we can ask questions as well. Usually they're not. Usually there's not many questions, mainly after. So after the committee is done with the discussion, then there will be a tentative approval. The vote we'll make is a tentative vote, with the final vote coming at the SIFC open hearing, which is February 12th at 5 p.m. in the MU ballroom. That's where the final fee level will be decided. Yeah, so now, go ahead.
Okay. All right, so thank you for your attention. And I wanted to introduce SHAB membership. We have 12 students on our SHAB board and 4 faculty members. We met multiple times through the quarter in fall and have been meeting all through January to present this budget. And I just wanted to acknowledge the people who are in the room today and add Connie Rodman-Hughes. So thank you very much for everyone for your support and feedback throughout the process of understanding and presenting this budget. So I just wanted to say that Student Health Services is a full-service medical clinic on OSU campus that employs 106 individuals. 29 of these are student employees. And we have more than 60%, up to 66% of all of our students on campus have been to the one medical appointment throughout the year during last academic year. We have physicians, psychiatrists, nurse practitioners, physician assistants, physical therapy, x-ray, technicians. We also have lab technology that we have to pay for, as well as a team of health educators and insurance, billing, and administrative support staff. And SHAB agrees that it's easier to stay on campus than to go off campus for your medical services. We don't have to worry that it's not good quality. We have really good coaching about our medical needs, and we can work, because we have MDs in our staff, we can work on complex health conditions on campus. There's also an affordable component to this service and comprehensive referral systems across different areas of need. And it does cost us. We pay $89.09 every quarter. In return for that student health fee, we are getting unlimited access at no additional charge to all of the providers. So we can see the physicians, the psychiatrists, nurse practitioners, physician assistants, and that is in this pie graph. You can see that we collected 54% of the whole budget that's presented here today, of $12 million plus. And this is our ideal budget that we would like to see. There are budgets 1 and budget 2. This is budget 2. But 54% of the incoming budget will be collected from health fees, and in comparison, 57% of our outgoing budget is assigned to the salary and OPE of our employees. So basically, we're collecting this student health fee, and that is subsidizing our ability to hire a good core group of providers.
Will you stay there for just one more second?
Sure,
Sorry.
sure. These are numbers.
Yeah.
They also should be in one of these.
They are. This is in the back of your packet. I can go through the other pieces of these pies right now. We also have, so on the incoming budget, we see, the health fee is the main source of income. Next to that is the cost of other medical services. So that would be x-ray, physical therapy, lab work. All those cost us money when we come into the student health center. So even though you can get a free appointment to see the physician, you do have to pay for all those extra things. Another portion of our incoming budget is student health insurance. And here it shows 17%. Basically, we have insurance for the international students. We have a domestic plan available, but only 85 students have enrolled in the fall quarter. Down from 200, about 200 the previous, 150 last year. So we're losing effectiveness on having a domestic plan. We maintain a plan that's mandatory for international students, and we're increasing the use of that plan through international students. We also have the graduate assistant programs that ensure the students who are also budgeted through this. Is that true? And then there is a reserve working capital, and we're spending that at a rate of 7% at this time to manage this budget at this rate, at this fee level. And to just summarize, the budget 2 proposal requests that we maintain the student health fee at $89.09, which is the same fee that we have been collecting all through the year of 2012 to 2013. Okay, so those are the major components of the incoming budget. And the major components of the outgoing budget, as I said, 57% paid out into salary and OPE. Supplies and minor equipment are costing 13%, and purchase services are 10%. Those are the elective, when you come in past your physician's time, all the supplies and testing that's done. And then it really balanced, we took 1% out for administrative fees for student health insurance. So that runs through our budget, our total budget. Okay. All right, so and the other things, in addition to what I've already talked about, we really have a great health promotion team. Nutrition counseling, we hired a nutrition we hired a nutrition counselor, dietitian recently. We have also we have an intern, dietetics internship program. We have tobacco cessation and free supplies for anyone who needs supplies for that. A health coaching, self-care, and also you can reach the health center to talk to an advice nurse by the phone after hours and during business hours. And even if you're out of the area, you can still call the health center to have a prescription called in or something. And I want to say that health promotion doesn't comprise a very large portion of the budget that we use here. It's just 7%. But it is significant, and that we see we expect that 35,000 student encounters will occur during this particular year, 2012 to 2013. So health promotion, though we spend not a lot of money on it, does have a lot of influence in the community, in the student community. So the services that are not covered by the OSU health fee, I just thought I'd go into detail about x-rays. We had some discussion about that last year. Basically, x-rays are being offered at cost and below cost to students here, and we do contract for a reading fee, and that is a 30% rate. And if any student would like to know the cost of any service any of the extra fees before they go in, during their appointment. After the appointment, they can look these fees up. Other services that are not covered by OSU health fee are lab work, physical therapy, the massage, acupuncture, and chiropractic services at Dixon. Immunizations are an addition. Prescription medication, you can't fill your medical prescriptions unless you have money to do that here at the Student Health Center. But it is put on your student account, and that can be paid through your student account on that timeline. You could also pay at time of service. And if the student carries an OSU student health insurance plan, it can be billed to that plan. In addition, I wanted to note that the cost of a consult is only $75.60 for dermatology, surgeons, gynecology, and orthopedics. All of these specialists come to see the students on campus. So those are quite subsidized rates. Any of those visits would cost you $400 up and up in another community setting. So Dixon is not just a place to work out. We have a nice treatment team here to help people recover from injuries. And that is part of our budget. As you can see the details of our budget, we do have a significant amount of money transferred on the account of these services. We have to pay a rent fee to have that space, but then we also collect from the students for every appointment. We collect a fee. And just again, I wanted to emphasize that the Health Promotion Department is a great place for, I'm a public health student, and it's really nice to have a place for our graduate students to have practical experience and work directly within the community of students that they know. I think it helps me, even if I'm not a graduate student in public health, that I understand a little bit more of their work on campus. It gives me a window into a professional area. And I think the same for student health services at Dixon. We have an exercise science program on campus, and I think it helps those students to have that exposure. The new things that happened at OSU this year, we have a non-smoking campus. You can get your flu shots, and it's only $15. You can get hepatitis. I went to China, and it was really, I think, beneficial that I had hepatitis. Longevity improved. I mean, I didn't have hepatitis. I had the hepatitis shots, you know. So it's really many other. We have HPV vaccine for free, right? That's a program. So I had plenty of exposure to hepatitis, and I didn't get it. Thank goodness. That's because I had my vaccine. And then really one other thing we looked at as far as our budget 1 proposal of how to cut corners here, we thought about closing the clinic some hours, but the cost of keeping the clinic open really doesn't take away from our if we don't cut on staff hours, you can crunch them into closer space, but it means that we have a harder time fitting all the students into the space, and it also means that they have less flexibility for their own comfort in their lifestyle. So I think that it was $10,000 savings for us to shorten the hours at the clinic, and it would cost students to go into an acute care clinic, an urgent care center, or the emergency room. It would cost them multiple, and we could go in for free on Saturdays. So it saves us significantly as students to maintain the service hours. So formally to present budget 1, by adhering to the 0 increase budget where we would not be increasing, in fact decreasing the student fee to about $4. This would allow us to maintain the same amount of money collected from student body through student fees through the next year. It would cost us $264,000 of the budget that we need for the projected year. And we would have used those to pay salaries and FTE as required by law. And so in order to reduce that budget, we thought about things that we could cut. Different things that add together included not hiring physicians. There's one retirement scheduled in April. But we would be down in our ratio of physician to student ratio would be not appropriate, or it's not physician to student, but it's physician to other types of providers that we compare. And then I already talked about closing the clinic. The other thing is stop funding the C-Care, which will probably be more of a salient option in the future when we are under the Affordable Care Act and we have a mandatory health insurance that includes contraception as part of the plan. And then another savings could be to cut continuing ed costs for our student health services, but I think that would cut the quality for students. And so, in conclusion, SHAB does not support this budget proposal. We would like we already had a vote together, and we refuse to support this type of cut. Okay. And these are the details of that budget, totaling $12,023,398. The health fee request is reducing the fee by 3.9%. We would also find some small costs in advertising, food costs at events, and the elimination of plant care. That's the 2% reduction that we could add to make sure that was a 3.9% decrease. So on to the budget 2 formally. It is proposed that we would maintain the student health fee at $89.09 with an expected increase in enrollment. The fee collected at $89.09 will meet the expected shortfall and mandatory increases for OP and salary. This decision package is to maintain all services and programs as they are in 2012 and 2013. We're not asking to hire any new employees except on one exception, and we have not decided to hire this new employee for full-time, but she was hired at half-time FD, and it might be more efficient to allow her to work full-time. She's our clinical application specialist. So in summary, the budget 2 is $12,099,201, and the academic health fee revenue is up to $6,049,203. We would increase the health fee by 0%, and it also, in this budget, we include a 2% reduction in some non-care related costs, advertising, food at some of the programming, and eliminating the life plan service. So I want to review quickly. There were some changes over 2012-2013. 5 new employees were hired. These are not all full-time. We have more insurance support with the intention that in the future we could bill more broadly the different insurance plans. But this person is not nearly sufficient to do that. Actually, it seems to be that this person is meeting the need for some increased enrollment in other types of plans that are OSU-based plans. We have an IT manager and a clinical application specialist helping us with the electronic medical record, a psychiatrist who has been active in other areas, very active on campus. I'm learning about the Veterans Affairs and care for our veteran community, and she has some experience in that, so we have a work group going, and that's pretty neat to have her expertise on hand. She's, yeah,
Am I allowed to ask a question right now?
you are.
I'm just wondering why SHS has a psychiatrist when there is CAPS. I
Right.
could
So-
detail that more.
Yeah,
if you'd
so
like.
psychiatry is a medical professional. Can George answer? Yeah.
So, the CAPS staff are psychologists. They can't prescribe or manage medication.
Yeah.
So having psychiatrists on staff allows us to be able to help them with that, as well as do counseling within the health center too.
Okay, I just wonder.
And really, a pretty cool thing is that she has experience with working with VA healthcare, and she was able to help us negotiate with the VA to do reimbursement on medicine and local service beyond the Oregon State as well. So she's advocating for our veterans on campus. Pretty cool. We also hired a new medical assistant, so it's a good team. I think all of our new. We also hired recently Robert Reff. And he's been really active in alcohol and drug prevention on campus. So I just have some long-term, in addition to what I've said, there is the need to maintain contingency funds and fees, because in the long range, we do have a new building in the recommended long-range planning, because our space in the Plageman building is really not sufficient to expand any more staff.
That building we approved through a capital construction budget within the university, though, not with your
That's a separate
reserve funds.
budget. But the
Yeah.
thing is, we do need to maintain in the contingency fund enough money to buy equipment and supplies for a new building. When we had an upgrade in the building recently, that budget was assigned. That was where we came up with the funds to buy new equipment for the upgrade.
Was you said your working capital?
What?
You used the working capital.
George, maybe you
We
can
use the
explain.
major projects.
Major projects. Okay.
Yeah.
When is it planned to build a new building? Like, is there
We
a
don't
year
have-
that they want to
we've
have that
talked
built
about
by?
it, but we don't have a specific date.
We don't have any
Yeah.
information yet on, we've done some conceptual design planning, so we have some ideas of what we need in a building, but the actual funding for it is probably several years out.
So,
I
just,
recommend stairways that go up and down. I also have that problem.
are you talking about budgets or buildings?
Sorry.
Okay, so I'm gonna turn the floor over to one of our SHAB members, upcoming leadership here, I think. And I just wanted to say that we have spent a lot of time talking about the Affordable Care Act and how, as a group, to respond to the current climate of uninsured students. We have up to 4,000 uninsured students on campus at this time.
How many?
So
How many uninsured students?
Oh.
4,000.
4,000, that's how many, okay.
Yeah,
Yeah,
I'll just
sorry.
turn this over quickly. So for those that didn't know, my name is Hunter Aldridge. I'm currently a junior here, and I'm a member on the Student Health Advisory Board. And what I am just going to discuss and present for you today is kind of student health services and the SHAB's kind of vision for going forward for the next 9 to 18 months with regards to change in services and the status quo here at Oregon State University. So current status quo, we as Student Health Services provide students, all our students with available health care, but there is this critical safety net in that we provide students who are at risk with care. And what I mean by students at risk is there's approximately 4,000 students who do not have health insurance. These are students who are in many cases in financially precarious situations. And so if they do have medical costs, they pay for those out of their own pocket. And Student Health Services essentially acts as their only really good available primary care, because of the student health fee actually providing them with free unlimited access to see providers, they actually have the ability to come and see a provider free of charge, which for someone who's incredibly financially strapped, that's huge. And so that's a major point that we provide as a large group of students, we're their primary care. It's not like they can really afford to go and see a local Corvallis physician for $200 to $300 for a visit. Financially, that can't happen for them on a consistent basis. You know, if they get bronchitis or something, they can't even get checked out without breaking the bank or going into debt. So we also provide care beyond what just one primary care physician or physicians group could do. Like Jai mentioned earlier, we do have community provider contracts. The 7560 number, which again, approximately $400 is what you would pay to have a similar consult through Samaritan. And we also have subsidized service that are actually quite good. For example, testing, blood test, one is like a complete blood count with differential. That's $44.65. That's a rate we charge. EKG, $68. X-rays, you know, as you saw before, between $84 and $120. And then even procedures such as biopsies, we actually offer for $102.21. And those procedures, even with insurance, even on an 80-20 plan, you'd still be paying a very large amount of money to do that, even with insurance. So with our subsidized rates, we actually are very competitive. So it provides these students that do have no access to insurance, not only quality primary care visitations, but also access to, if really necessary, very well-priced, subsidized services, imaging, testing, and procedures.
EKGs are actually part of it.
That's correct.
They're cheaper than X-ray.
Yeah, just because it's a equipment issue, and I believe, George, it's also reading. It costs us more for our radiology to read than for EKGs.
One correction on your consultants, it should be gynecology, not oncology.
I'm sorry. Yeah, I noticed that. Just I read that. But yeah, it's gyne, not oncology.
That could be oncology.
Yeah. And so, as I said before, ultimately we provide students with those with financial burdens, consistent, affordable, and great quality health care, and beyond what they can just get to a regular primary physician out of their own pocket here in Corvallis. And what it essentially acts as is that 8909 for a group of about 1/6 our student population, that's their health insurance. Again, 60% of our student population uses student health services, 40% doesn't, but that 8909, those students that don't have access to health insurance, they're able to come in and get care. So if you look at it as a sense, they're paying that fee and they can actually use it. So while not everyone uses it, those that do need it, it's a pretty essential part of their lives if they cannot afford it out of pocket. So barring catastrophic issues, for most of those students, out of that $4,000 for the 4 years, that student health fee is going to be able to cover a lot of what they would need care-wise, and that's important to recognize. Because that status quo is going to change, coming January 1st of 2014, as some of you are probably aware, we are having a mandate that all we require to have individual health insurance. And disproportionately affected will be that group of 4,000 students who do not have access to health insurance, mostly just pure financial reasons. Parents don't have it, they can't afford it out of pocket. Families, students living on their own post-bac. It's a very difficult situation. Now, within that group of 4,000, there's also two subgroups. There are those that are in an income level low enough to where they can actually qualify for state and federal assistance, such as the Oregon Health Plan or Medicaid for their health costs. But unfortunately, at this time, there's issue with funding for those plans through the state of Oregon because of the coming mandate and through the exchanges. And then the other group in that are those that are above the income level, in which case they would need, they qualify for subsidies and assistance, but they don't have the ability to actually pay out of pocket. So essentially they're kind of stuck between two walls. They can't get government assistance and they don't have the money to pay for it themselves. So with that in context, a driving question we've been asking ourselves on the Student Health Advisory Board is how are we going to ensure access to care for these 4,000 students, considering that we have this coming mandate that will disproportionately affect them because they're going to have to get health insurance some way, either on an exchange or through whatever means they can, or they would be charged through the government. And so what we are looking towards, and this isn't any sort of decision, but this is one we were looking to try and alleviate that risk and try and advocate as best possible for those students, would be to have a mandate in roughly the 2014-2015 school year that those enrolled would have health insurance. if you don't have what that means is if you didn't provide proof of insurance either through your parents and employer or on your own, you could purchase insurance, or through an exchange at that time, you could purchase, you would be assessed a fee through your tuition, and you would be put on an Oregon State University student health plan. And ultimately, students are gonna have to have health insurance, whether it's a required mandate of Oregon State University or not, as of the 1st of next year. That's something we can't change, so we've been looking at how best to alleviate the possible negative impacts on our student population, and specifically those that are disproportionately affected by it. The rationale for that, again, they do have to purchase it, whether it's mandated or not. There's a lot of logistical hurdles to try and tackle this issue in this school year, and that they're ones I don't think we're going to be able to overcome just due to the vastness and the complexity of the issue. And a mandate that late has a couple factors. The biggest thing is it allows Oregon State University as a collective student group the greatest room to negotiate and leverage, as well being advocated for by other groups such as Student Health Services, OSU, because those prices that we can work out with underwriters and providers, those we can negotiate against against the exchange prices that will be established. That exchange cover Oregon. The plans will be available for purchase in October of 2013. August of 2013 is when they're looking to actually have the information on how much it's going to cost to purchase those plans locked down. From what we've heard, as a student plan that Oregon State could provide, that would be between $1,600 and $2,000 per year, and that's for an entire year. That's not an academic year of health insurance. And what ideally that would allow us to do is we can actually negotiate down against the exchange prices, and ideally have a price we could offer to students that is below what they would get on an exchange. So if they weren't getting coverage through their parents or through employment, they would actually be able to purchase a health insurance plan that would be more competitive than ones they could actually find on the exchange, and they could purchase that more conveniently and use it more frequently through us here at Oregon State.
I have a question. So they would have to start paying, they'd have to either have health insurance or pay student health services for health insurance starting January 1st, 2014.
Well, you mean as far as our context or the actual, for the Affordable Care Act, how they look at it?
Your context.
For our context, we wouldn't,
You would make it a requirement until
we wouldn't make it an Oregon State academic requirement for enrollment until 2014,
Okay.
2015. However, that does mean, but not an Oregon State requirement is the Affordable Care Act, so
So, for example, you could pay the fine and not have health insurance as a student for like winter and spring
Yeah.
2014. and
yeah,
summer
which
2015.
it's an unfortunate stopgap if that was the level of income that, if you had to pay the fine, it does scale as years go.
Yeah.
But yeah, but we would not be mandating as of like January 1st, 2014 that it would be an academic year based.
So next budget cycle, you'll have pretty good information on the price, the amount of students that will be enrolled, so you can incorporate that in your budget and your plans, as I see.
Yeah, and that is the reason why if we were going to mandate, we would not do it the next year, is because essentially the information that's incredibly critical to it's not there. And the biggest thing is this isn't just a student health services decision or issue. This is something that we are actively trying to get integration with students, multiple student groups, OSU. We're working to also try and coordinate with other Oregon university systems. University of Portland actually mandated student health insurance this last year.
Was it that was PSU?
Or yeah, sorry, PSU,
Yeah.
not University of Portland. They actually did mandate it this past year. The University of California system has had a mandate there for a long time, as has the entire state of New Jersey, the New York University system. So there are university systems that do incorporate this, but ideally we were going to try and start working with getting information from Portland State, from seeing how University of Oregon is going to address this issue, and basically try and play off of ideas and try and integrate as properly as we can with all the parties at play. And again, quantifying the unknowns is our biggest thing over the next 9 months. We aren't aware of what the poverty line economic level cutoff is going to be for subsidy and assistance on healthcare, which is why of that 4,000, we can't give a reliable estimate as to who is going to be unable to pay but not able to get subsidies and who isn't. So that's critical. That's information we're waiting on. Student demand is another thing. We're looking to try and find multiple methods to anticipate student demand, whether that be surveying incoming students, current students about their current health and financial situations, for healthcare. Exchange rates, again, August of this year, hopefully we'll have that information. And then just premiums, and just, those are always changing, but unfortunately the trend is going up. So we also want to know through different underwriters and different providers what they can offer us and what kind of cost we can get. Because the biggest thing here is critically emphasizing that this is a student issue. This shouldn't be something that is done in back rooms. This is something that actively needs to have student involvement and a student voice. So again, over the next 9 months, that's something that we at Student Health Services are going to be working hard to get into kind of a public opinion and into the mindset of students, is that we have this change coming, and having students try to actively participate in the discussion about the future.
Have you talked to ASOSU at all?
That's kind of on our process. The budgeting's taken up a lot of our time, so going over the next term and a half,
Okay.
that's what we're working on.
The Health and Wellness Task Force Director sits on SHAB, right?
Yeah, so she does. So
Okay.
we have contact through that.
Okay.
But as far as official hearings with ASOC, we haven't had a direct
Yeah.
link yet. Also, risk management through the university, that does come into play because it is a group of 4,000 students who,
They supported it. They were with us at Washington,
Yeah.
the risk management,
So-
that supports having a mandatory
Yeah.
insurance plan.
so we do have some of the administration that are aware of that. And then also, the administration, the registrar's office, there's a lot of different things that are gonna come into play regarding the mandate, which it takes a long time to get all the information in. For example, when students have to apply, they have to be aware of the costs that will associate with coming to Oregon State University. So if we do have, if it is the best solution for students and for the university to go with a mandate, and that comes into play, those students who apply for the 2014-2015 year need to be aware. So somewhat of a timeline is us having, if a mandate is decided, again, this is just a kind of a vision and idea at this point. But it's one we're actively working towards, and if it is something that's decided on by the school and administration, that is something we want to have aware for those applying next fall and next winter as soon as possible.
Yeah, my biggest concern is that many students are here on student loans, and they may not be getting subsidized loans, they may be getting private loans, and I just don't like to see health insurance as one more addition to their student loan debt, so that's my concern.
So ultimately, our biggest goal, besides just getting all the information we need to make the best informed decision, is increasing student awareness and public awareness of this. It's not an issue on the forefront of most students' minds, and unfortunately, it's probably not one on the mind. It's not going to be one on the minds of one of those 4,000 students day to day, but when you have a serious medical issue and you are stuck with thousands and thousands of dollars, then it's an issue. And our biggest goal is we never want that to have to be an issue for our students. We want them to be able to continue to attend Oregon State University without being disproportionately affected by medical ailments or disabilities.
I have a good question just in regards to that. So as you go further in conversation, and in the planning process for this and what it's going to look like if OSU were to pursue some sort of mandate for their student population, what would be the steps, or at least have you all, it could be so early in the process that it hasn't really come about yet, but have you discussed how you would include, because you chose ASOSU and certain organizations for getting the word out about the initiative, but not in regards to actually establishing what the initiative would look like or if it should exist in the first place? Because I know that just because, you're talking right now, it's not on the forefront of a lot of students' minds, but nor was, kind of like this, first year experience project, things like that. Now students are learning about it, there's a requirement, many students have had a lot of vocal opposition to a requirement, and they've, suggested they would go to a different school. So is that a conversation that's starting to play into, or a piece?
It is early in the process, but that is a conversation we absolutely need to have. This, like I said before, this can't be a decision made in back rooms. Students need to be involved and understand. They need to be involved in their own advocacy. So if this is something that students critically do not want and critically would not, as a vast majority would not want this to happen, that's something we need to know. It can't be something that we hear and then sweep under the rug. So
Sure.
Involvement in the actual, whether it goes through or not, that absolutely needs to have a student voice. So it is early in the process, but we're trying to establish student opinions as soon as we can and getting the word out. So there is discussion somewhat of trying to either survey students as to what they would possibly think about it, just trying to get as much information as we can within the next 9
It
months.
seems like Was that all, by the way?
Pardon me?
Was that the end of your presentation?
Yeah.
Okay.
My main concern with you is, school is expensive as it is, and students are already gonna have to deal with the national mandate.
Mm-hmm.
And an expense like healthcare, especially through the school, I wouldn't wanna see students just because they can't pay for that extra health insurance. I mean, that's one more bill on you, and I'd hate to see students have to forego university like this just because they can't afford medical
price.
care. Just because they can't afford that extra bill, and that is a significant amount. Healthcare is not just, it's never a small number.
It's not a small, at the point, as of 2014, it's not an ancillary fee. And so that's the thing, is that our goal is to try and minimize whatever disproportionate effect that is to those students. The unfortunate fact is,
There must be some negotiating power we
Yes.
have somewhere.
we,
Let's use it.
it's not right that students would have to not receive health care and essentially pay a fine because they can't, because they're in a precarious financial situation and are between where the government can give them assistance and where they can pay on their own, and instead they have no health care and just pay a fine. So, a fee essentially. So we need to try and find a way to advocate for that group and to make it so that they are found an affordable way to not only receive health care, but stay in school. Because again, we don't want to have people having to leave school due to increased fees just for health care. But the unfortunate fact though is that of those 4,000 students, if they are, and I say catastrophic health issues, I've had, a friend in the last 9 months get cancer, and he had to leave school for it. So things like that happen, unfortunately, and that's a fact of life. And people aren't aware of it until.
I carried that for a long time.
Yeah.
And
Yeah.
I kept going to school because I thought that my opportunities were greater if I had more education. And I could handle having, it was a negotiation with a hospital, a billing system. And it's definitely made me aware of, I was hypersensitive, and probably, it has a lot to do with the reason I'm sitting in front of you today. It's really, it's uncomfortable having a bill for a long time. It doesn't seem quite fair because it's not something you purposely don't do. It's just happening to you. When you need medical assistance in our country, we provide health service to every person who walks through the door, but we held them for the bill for years.
And I think that medical care is definitely something students need. But at the same time, higher education is the purpose of this university, and I would hate the decision between the two.
So the reason I didn't support going all the way to mandating next year was because you can see that it would be $8,000 for a 4-year student at $2,000 a year. So that's a lot of money, and if it were me, I would put it on my student loan. I would still go, but that's, adding to our national debt and our collective ability to admit more students into the public education system.
And that's the reason why we're trying to start this conversation actively with students so early, is to get them aware of the situation that's coming and try and work to the absolute best solution possible. Unfortunately, our hand is somewhat, due to the laws and, recent legislation in our country, our hand is somewhat forced with this. Our status quo is going to change, so we just have to work with the best we can to the best opportunities
But
possible.
we can negotiate. We'll find our way.
Exactly.
Cool.
Any further questions?
Yeah, I had some. So for mandated expenses, I was rather unclear on what it would really add up to. I'm not sure what your total mandated expenses were. That was one of my first questions. Do you guys know what your total mandated expenses were in increase?
Oh, the total mandated in budget too?
Yes.
The decision package?
Well, yeah, how much was mandated increases?
The mandated increase in the total budget
Yeah,
is a percent, let's see. For the health fee, it's a 4.6 increase, but the total budget
let's go dollar amount of your mandated increase.
For the total budget,
So
right?
dollar amount for the mandated increase of
Yeah.
health
Yeah.
fee is, the dollar amount of increase,
Like, so how much, yeah, I guess, what was your, I don't know, mandated increases from, that was given, like, from the sheet that you got? How much, what was your actual total mandated increases for the
The overall budget for
Yeah,
the
for
fiscal
overall
year that
budget,
we're
just
referring
what
to.
was the mandated increases?
Brad, can I help?
Yeah.
So if you look at the first page of the first budget presentation, it
Yeah.
shows the $264,675 shortfall.
Uh-huh.
That makes up our total mandated increase.
But it's not broken down line on where the
Well,
mandated increases
No,
come
so
from.
there's roughly $75,000 from actual salaries and another 214,000 in OPE, and then the balance of it is in other supplies, purchase service costs.
It's just the difference.
Well, I mean, okay.
It's just the difference between all of them.
Right, yeah, because I mean, well, there's a, do you pay students a minimum wage?
Most of them get more than minimum wage.
Okay.
So any student that receiving, that is paid minimum wage would then have, there'd be a mandated increase on their salary with, as minimum wage increases.
Right, so that's part of that, 74,000.
But it's not, is there, okay, so is it ever broken down into the 264,676 as to where the mandated increases are coming from, or is that just like,
So, well, if you look at the comparison there, the 2014 budget decrease from 2013, that gives you the changes in the budget by each line.
yeah,
And the mandated increases are mainly in staffing and OPE costs. And then there are some in purchase services and in supplies where we have to allow for medical inflation to our expenses, so those are built in there.
Yeah, cause, well, at least from the budgets, from the budget you submitted, just from the salaries and OPE, it seems, just there's the rough number adds up to 288,000, and that doesn't include student wages or any assessments, which is more than the net from all, your loss, your deficit for the first budget. I guess, like, it's not demonstrated really anywhere what your actual mandated increases are. There's rough estimates for salaries, there's no number given for student wages. There's no number given under services and supplies, which I'm guessing includes assessments. I know assessments went up quite a bit for different budgets. Yeah, so that, I mean, that's something that is not, we really want to see that number.
Well, if you go to a little bit further into that first budget,
Like this one?
yeah. You'd like the fourth page in, to the combined operating statement. And that shows line by line all the changes from FY13 to FY14.
and so every change then here, you're saying is a mandated increase?
Yeah,
Because
no.
when, no, yeah, it can't
Yeah.
be.
So I mean, yeah, that's where
Yeah.
it's like, I mean, I guess we might be able to go in, like, we could, well.
Even if
actually,
you
we don't
went
even know
line
if
item by
there's
line item,
one.
you're
There's
still
no-
not seeing specific mandated increases, so
there's
you're just
no
seeing
water,
general.
sewers, or garbage, electricity charge in this. I guess there's,
Yeah, there's utilities right roughly in the middle of the page.
well, here we go, well, there's,
At 23,010,
utilities is all summed up. Okay, can't find that. I mean, there's a line item that shows OUS and OSU assessments that went up by $100,000.
Right, that's.
Yeah, I mean, that's.
The state and the business affairs assessment.
Mhm. That would be at least, I don't know how much, I don't know if that's all mandated. I think it is, but that'd be something that we'd wanna see when you talk about mandated increases at the beginning of your budget submission.
Or even something like just looking at the percentage of electricity costs, like you're going, what?
The budget guidelines said those were gonna be going up 5%, so that's what I use
Yeah.
to estimate those.
Yeah. It's just, yeah. And also on your second budget, you used for your summer enrollment a number of 5,900, which the number should be using is 6575.
59 is the number that will be for this coming summer, which is
Right.
the part of the
Wait.
FY 13-14 year.
Because you set enrollment for the following,
Yeah.
so the 6,900 is for the following fiscal year.
The,
So this is
the
a budget.
6575, the summer
Yeah,
enrollment?
so it's like, because you set already for FY 15.
Yeah.
The 5,900 was set last
Yes.
year.
For the
So
upcoming
this summer has
13,
already
14.
been set
Uh-huh.
as you go in and prep this budget.
Okay, why? Is it from caps? Okay. You have to explain that one,
Thank you.
yeah. Okay. Does anyone else have any questions? I have some more.
Yeah, I have a few questions about the transfers and the drawdown, basically within, so you're looking at your working capital fund, your 130001. Was that just on, what, June 30th is the most recent, apparently? Being at just over $3.5 million. And the recommended, like, 105% over a 5% max for OUS's recommended amount. I'm looking at, let's see, looking at transfers, particularly from last year and this year. I'm wondering really where those efforts are, if they're as aggressive as they need to be in order to still be sustainable, but at the same time, like working down that large number for as far as the working capital and then major projects fund. Because looking at major projects being used, it looks at like through FY17, you're going to be using what, $275,000 out of that entire fund. Correct.
So, again, just with, when CAPS was presenting, these have to be analyzed on a year-by-year basis. At this point in time, at these levels, the, working capital would be overdrawn, so to speak, by the end of FY 17. So we would have to, next year, when we go into this process, reevaluate how much is being used and, you know, what's sustainable. Because again, like they said, you don't want to get to the end there and have to have a huge fee increase.
Oh, yeah, definitely. But at the same time, we also want to make sure that we're like sustainable within the amount that we're actually charging students, so we're still staying relatively close to the OUS recommended limit.
Correct. So both the drawdown of working capital and the major projects fund need to be reviewed every year so that the external report that was asked for by the fee committee last year and completed in January this year, or last January,
Yeah.
suggested that the major projects fund should be held at around $3 million. This scenario shown here has it at 3.2 million by, or almost 3.3
Mm-hmm.
at the end of FY 17. So we might need to look at, you know, the amount that's being pulled out of that on an annual basis. And again, we need to look at over this time so that we don't, again, have to have a large fee increase at the end of that 5-year period. We want to have a soft landing, so to speak.
Total transfers.
So for your second, so for your working capital plan, and then your second budget, you use different numbers in
Yeah.
your drawdown. Your requested budget, is a transfer of $109,000 from working capital, and then on this
That's about
plan, it shows a working capital drawdown of $404,000.
Yeah, we ended up splitting the total of the 873,000, divided it in half, and we did the working capital display.
So, but that's not what you're really gonna be doing then?
Well, again, as we go through the year, we'll make the decision on where's the most appropriate place to bring it out. We're gonna bring out or use approximately 873,000 in a year. And the lion's share the plan is to use it out of major projects fund.
Yeah, but also even your total amount on your budget is 823,000 and show 809,000 on your working capital plan. So there's a difference, even the gross amount.
That's an error on my part. I didn't watch the numbers on those two pieces.
Okay. I would say that for your working capital plan, we want it to match the budget. Even I understand how it would work, but like, if you're taking $700,000 out of your, major projects, that's drawing it down really quick, and it's not gonna look close to what it's gonna look like on this working capital plan.
I agree.
Because you're talking about, let me see what you're referencing, 'cause I think I'm looking at the same thing as you are.
So these two numbers,
Yeah.
and then the numbers. Right, right.
Which budget are
Make
you
sure we have
looking
the
at?
same one.
Second budget.
Yeah, I'm looking, that's what I was wondering too, is with those numbers not matching up, but also if you do take that out, you're not working down actual working capital, you're just working down major projects fund, and then you're way over the projected working capital overage of, or way over.
What was the justification for choosing to get rid of C-Care if you were, with budget one?
The purpose there is it is subsidized by the overall health center and health fee at this point. And if we had to come up with the 284,000, without an increase in the actual fee dollars, that would be one way of accomplishing that. Because it's about $198,000 that it's being subsidized.
Okay. Did you do like a sort of, kind of like cost benefit on that one?
Like how many students are actually using the service as opposed
Yeah,
to other
'cause I-
services that
it
may
just-
cost a similar amount?
To me, it seems like I mean, wouldn't want to be reduced, or you wouldn't want to, maybe you wouldn't want to cut C-Care just because of how many students it serves compared to the cost, which out of a $12 million budget and net cost of $100,000, it's not a whole bunch.
Well, the first budget process was an effort to, how do we cover $264,000, if we have no other option of raising the health fee or keeping it the same. So we had to look for, and none of the options are easy, comfortable,
Yeah.
or good. I mean, not replacing a physician is not a good process either for the health center. It would reduce access to care, it would extend out appointments, it would reduce the ability to manage complex cases. But hiring a physician is $170,000 way to save that much money if we didn't replace that one. So there were no easy ways of covering that, other than, I guess, the other option could have been to increase the amount of major projects, working capital that are used. But even that didn't seem like an appropriate choice, given the fact that we're already using, over 800,000 of it. So we came up with possibilities that could cover the shortfall. But as Shad and Jaya says, that, they don't, that was not their choice of presentation and support for budget, they overwhelmingly support going with budget 2 and keeping the fee at 899.
Zero-based budget. They didn't give us a lot of options, we didn't know how in the time frame to really spend, we spent a lot of time, I know that the leadership team spent a lot of time trying to think of ways to cut the 200 and plus, just even some part of this budget, but we couldn't think of ways to cut it.
So there were
And
other.
so we kind of had a strategy of putting things that we thought were really valuable up there and saying we won't cut anything, These are things that are valuable, and, I don't know, we just couldn't, I don't know about the time frame. What else did you want us to evaluate? When we looked at health promotion, it's not a large portion of our budget, there's not much we can cut out of that, so.
What,
But C-Care is something that's in the future, or maybe not part of the budget, because it becomes part of a mandated health insurance fund.
how closely tied is health insurance revenue with, I'm guessing pretty closely, but health insurance revenue with the health insurance premium?
Yeah, they collect the premium and send
Okay.
it to the.
So like,
company.
if you were to drop the
It's
estimate
1%.
for revenue for health insurance, then you would, the expense and for health insurance premium would also probably go down pretty proportionally.
Yeah, that's basically tied to how many students take the plan.
Okay.
Collect it and send it to the company.
Okay.
And there's an admin fee of 1%.
Okay, so when going through, like wondering, because I'm kind of wondering the same thing with C-Care, like looking at all the different programs offered out of a $12 million budget, like there were not enough students who used a program that, cost $190,000, that was deemed as like an appropriate cut, or was it something like you said where you kind of just picked things that were important but not small enough? Like what are you, because.
Yeah, it was hard to, with the time frame, it was hard to come up with things that we thought were valuable, and even, so then we said, okay, there's a number we're trying to meet, and let's look for things that were costing, how much they cost, and things that were kind of, vulnerable at that moment, things that are changing that would be easy to work with, like.
So the justification then would.
Physician retire, you could wait to rehire one to another time. With the C-Care, it is on the future, not
Mhm.
part of the budget possibly, so those are.
We
you
did
know,
have
areas
a
of future
person
savings.
resign from the C-Care program, the coordinator there, and we've made a decision at this point not to replace that person, and just kind of limp through the rest of this year to see exactly how the Affordable Care Act programs are going to affect C-Care. I've seen analysis that goes both ways that say the C-Care program or things like that will not be needed, and then there are think tank people who say absolutely it's going to be needed. There's still going to be these people that fall through the cracks that don't have any contraceptive access capability, and that those programs are going to be needed. So at this point, I really don't know where it's going to come out.
I'm just wondering how much you looked at the effectiveness and the use of other programs, because you just said that you put up good programs up here to convince us not to cut the funding, which I personally really don't like hearing, and I'm wondering how much you looked into all the programs that SHS provides, how much money they use, how many students they serve, and which ones really would be the ones that would get cut.
Yeah.
Because, I'm sorry, I just really don't like hearing someone coming to us and saying, well, we just wanted to show you that these are the awesome things.
Well, and that's
I
a
agree.
question that
Yeah.
it's like, as a group, we feel that all the services are valuable. And then in order to identify those that aren't valuable, how much time do you expect unpaid students to spend on that? On the other hand, you have a team of physicians who spent 50 paid hours to look at what they could cut, and they couldn't come up with a solution to this. That was the leadership team spent hours on this, so.
Well, can I?
Are you saying the leadership team came with C-Care, or you guys did?
C-Care was suggested to us, so, yeah.
As a group, our leadership teams went through our whole program, looking at everything that we do within the health center to determine, is something viable, is it worth keeping, do we have enough students accessing that, you know, so that's looking at, like radiology, for instance, are there enough people using that? It's not one of the biggest dollar units in the health center, but it's absolutely important that we have the capability of providing radiology services to students on campus when they come in with a turned ankle. You know, is it broken or is it just sprained? So you can't just say that that one's not valuable. We look at the lab services, and you know, there's no question there that that's of value in diagnostic capability. Then you can start to look at, well, is physical therapy worth it? And how many students have physical injuries that need therapy services in order to recover? So you can't, so we made that decision, that's not on the board. And then from there you start looking at health promotion programs, and the contacts that they have across campus are rising dramatically, they're not decreasing. The new dietitian that we hired, she's maxed out already, and we would love to have at least another half-time person in there working with her, but that's not gonna happen until maybe the next year. You know, things like the Everyone program, Beaver Strides, all those things are, have significant contact and student and staff involvement in the Beaver Strides program.
And
And
that particular part of the budget is not a significant
Yeah.
part. The health promotion doesn't cost a lot of money.
And I'm not denying the significance or the importance of any of these programs, and I know that this is a really difficult kind of challenge exercise to do, and it has been for, you know, any organization who is funded through student fees. But the reason we wanted to do that, and the reason we asked that of you, even though it is difficult to do, is because when you have an organization that has $3.5 million of working capital, it means that there was something within the budget that wasn't being used in its entirety, and that means that students were paying a fee for a resource that they weren't actually getting, or at least not, you know, at its full capacity. And so that's why we asked to try and come up with this and to find actual things that you could, you know, remove, like looking at, you know, perhaps subscriptions, books, publications, things like that. You know, you can cut out $24,000 or $22,000 there. Things like that can really add up, which no one wants to do, but it was in order to actually look at and try to figure out how we came about having these organizations funded by student fees, or primarily by student fees, with $3.5 million of working capital.
So
Also,
where is
a
that
number,
working capital history?
a number of the services just in that list were, when they were on the presentation, they were services that were paid partially or fully by students. Several of them were services provided by SHS, but like the radiology was,
Yeah.
and labs are paid for by students.
Yeah, it seemed like it was
So I just
mostly
don't get why that
salaries
was
that were-
even on a list of things to really cut.
Well,
Yeah.
because radiology is a subsidized service, it loses about $25,000 annually. So it costs us more to provide the service than we actually get in fees. Same with lab.
Yeah, that's a reason for a lot of the justifications that we showed above, the consults, the labs, the procedures, the biopsies, those are subsidized, we take hits on those.
Yeah, I guess just really like, because basically what you're showing with, when you show the list of services that you would cut, which, I mean, you're literally saying that, yeah, if we had this amount of money to deal with, we would cut C-care. And that's, I mean, I don't think that's a very serious answer, because it's tough for me to see how that would do it. I mean, especially so last year, you had $1 million left over after your budget. I mean, so I'm sure there are some things in there that you're not using as much
Brad,
as.
most of that excess has come from the additional enrollment that was higher than what was budgeted. And now that is being run through the health fee contingency fund, and we're being transferred only at the planned budgeted enrollment level, you know, that piece is gonna change. And that's why, you know, we're built in to be using the major projects and the working capital in order to cover the total expenses for the health center. That's why we reduced the health fee going into this current year.
I mean, one thing I do look at is like student health insurance premium, from last year. It came like $160,000 under budget, even though the revenue stayed about the same. And then for this next upcoming year, you're boosting the expected expenses quite a bit, even though it came in under budget. And just go to 12. So that's something that I guess kind of look at when we see like money where you can cut too. It just from the appearance of what it looks like.
So how would I cut insurance premium?
Well, I mean, no, it would just be like,
Your projection would be low.
yeah, it'd be like
Taking that
you
money,
wouldn't
putting
need
it
as
somewhere
much
else.
money because in the past it's been over budgeted.
Your projection would just be closer to what your actual
Yeah, that
need was over the past few fiscal years.
Then if it went over, it would be covered by the working capital from past years.
There's also,
But insurance doesn't go through it's interesting the way the budget works, because there's income for half of the budget, and then there's student fee for the other half of the budget. I don't know.
Athletics has to deal with that to a certain extent too.
yeah, also,
There's a lot
so
of-
on the working capital plan, I don't think you're including interest that you receive in working capital. You take, so the amount of money you're taking out of working capital is then your end balance, is then your beginning balance for the next year, and doesn't include any additions in your working capital, and there should be probably some interest as additions in your working capital.
The calculation is on there.
Well, at least-
On my sheet again.
From this one,
Yeah.
looking at this one, it's just, like, all I did was I subtracted 3.2 million, I subtracted 400,000.
It's on page 6 that you gave us.
So there's interest income up here on.
At least that's one of them. It should be on each of your budgets as well, but
Okay, so, so it's not
So it's being built into.
the budget instead of down here.
Right, because that's where it's recognized when the transfers by business affairs are made, they're made into a revenue line, interest income on investments, that's what it's called. And it shows up as a revenue line.
Okay.
But it's based on, the actual cash balance.
Okay, so it's up here. Okay, that makes sense. Thanks, thank you.
That's definitely so for us. Current fund balance, yeah, this is it.
Does, well, I'm not gonna be able to just figure out behind the scenes stuff. Does anyone have any more questions? And I think, how does the committee feel about this so far? That's what I'm trying to get at. Cause I'm not super comfortable.
Neither am I. I just feel like there have been a lot of issues raised in the past hour and a half, and they're not little number things. They're
So can you give us some guidelines?
Well, just the one thing is, how you kind of, you show the first and second budgets, there's a lot of increases in your expenses that we're not really, I guess, one question, why is, OPE, like, for example, your salaries go up $407,000, but your mandated increases were not that much. So I'm wondering what the I don't know what the difference is, and there's no explanation on why there's so much difference. Is it like, oh, is that all for mandated increases? Is there more, are you guys hiring
Is
another
that
position?
the physician that would be hired in spring? Or
I
to replace
don't-
the physician
It wouldn't be
retiring?
it wouldn't be to
There are
replace.
no additional staffing on here.
Okay.
So are there additional pay raises that weren't mandated pay raises?
No.
Then
Yeah, see, I
why
mean,
is-
that's where I have a problem
Especially if
is,
there's not,
yeah, I mean, there's, the salaries is 407,000, there is, when you go into their admin side, there's the assessments, that's 100,000. So that seems like maybe it'd be $500,000 of mandated increases, but it's not shown anywhere else, it's just shown in the numbers. And I don't even know how accurate that would be. So that's something where I get very uncomfortable with. Also,
yeah.
student, are you laying off any students?
No.
Is the decrease from adjustment of hours?
Pardon?
I'm wondering because student pay is going down. I'm wondering, is that just because you're kind of trying to adjust?
Wasn't that in the proposal earlier, George, with students?
No, it's.
I didn't see when I read through it.
The dollars go down on student pay just because of the actual hours that
Actual.
are expected.
Okay, that makes
So there was an
sense.
hour decrease like in the position?
No, it's
descriptions,
just, I mean,
or-
it's just, if you look.
Total hours used.
Yeah. Yeah, if you look in the past, going back some years, student pay is usually a lot less than
Yeah.
what approved, so that makes sense to me.
I also think that it just seems from this presentation here, and because all of the answers about the potential cuts to programs came from the advisors and not really the students here, it just didn't seem to me like there was enough effort put in. It didn't seem like you guys took the first proposal seriously. And that you just came, and I don't know if anyone else feels this way, but from what I heard, it just sounded like you came in saying, well, this is the way it's gonna be, and you guys told us to do this, so meh.
It's actually, we went through a process of asking different people, I think you were at our meeting, where we asked different people what was valuable, in the services and what you wouldn't cut, and we gave those suggestions to the, leadership team, you know, and so, I don't know what type of input we would, you know, what other input we would have, but other than, as a SHAB, we didn't agree those were appropriate cuts.
These were cuts that we found
We
based,
don't agree with the cuts either.
and
so
they were
that's-
proposed
that's
based
where
on the
SHAB
fact that they're cuts that could come if they were needed because they're timely, because a physician's retiring, because C-care could be phased out.
Yeah.
But they're not, they're cuts that, because to sit through and slang through the budget, because there's so many required things that to just go and say, okay, let's try and find a category and just lop 20% off of it, it's incredibly difficult. So as a SHAB, we sat down, found things that we could do on a timely basis to cut, and then on that basis, okay, here are things we can cut that are feasible because they're in a position to be able to be cut,
Yeah.
but do we wanna do it?
Okay,
That's,
well,
that's
Well, I
why
think-
C-care was.
was I the only one, like?
No, I agree with the way that they went about it. I think that one of the things, and I'm not putting any blame on anyone for this. It could be it could be a combination of so many things. But one of the things we've seen other organizations do or attempt to do or reach out to us and ask, is this what you're wanting? Within this ask that we had for you all was they would go look, line item by line item within certain parts of the budget and maybe cut, okay, here we can cut 15% off here, 10% off here, and all the way through, rather than saying, okay, here's these big programs that, maybe a few thousand students are using, let's get rid of it entirely. And I think that's kind of what we were looking at, was how do we reduce to make the budget as efficient as possible while still maintaining the same types of programs. And if it did mean that one program had to go, then we can understand that. And it's not what we want either, but that was the point, of the exercise and what we asked. And I do understand that in a non-paid student position, it is really difficult, and it's a lot to ask. It really is. But that's also part of the role of the advisors, is to go through and say, all right, in the past, 4 years, we've used this % of the money we were allocated for this resource, and if we only use 76% of it, then maybe instead of asking for that same amount or a similar amount, we can ask for 76% of it, something along those lines, to add up to those same types of, or to basically to meet that deficit that you were seeing. And I think that's kind of what.
Well,
Yeah,
let me explain the process that we go through, and there's verbiage in here in the write-up that explains it too. As a leadership team, we look at our budget every quarter and look at how we're doing compared to what we budgeted for the current year. When we start the budget process for the next year, we look at what was spent on each line in the previous year. We look at what the projection is for the current year that we're in, and then we may have a discussion to determine, is there anything that's going to happen or not happen with that particular line item that would affect the budget year? So for instance, if there's a new equipment maintenance contract coming in, then we know that that's going to be an increase to equipment maintenance and repairs over the current year's projection and over the prior year's expense. If we know that a certain contract is running out and it's not going to be renewed, then the reverse takes place. We remove that expense so that we're not just taking previous year's dollars expense and increasing it. We take the time to go through each line and make that decision. Is that line appropriate the way it's coming out?
And then us on the Student Health Advisory Board, as students, we go through and do the exact same process line by line. Once they're able to give us the information that says, this is what's going to change. For example, someone mentioned earlier subscriptions, books, and publications. A member of our board, one of the students looked at that and saw that and said, why is that increasing? And that's due to because that's medical reference software and things of that nature. And so we have students that go through and line by line look at this and do compare and actually do see, why are these increases where they are. And we do make those justifications.
Yeah.
So, but you've definitely seen some mistakes. I think you've been updating the budget in a
Yeah, I mean,
slow.
yeah. Even usually, so the first budget, the second budget, actually, the total expenses for the second budget are actually less than the first budget, which is kind of the opposite of what we expect when we see the first budget. Because usually, I guess one thing was in the first budget, you didn't actually really show where you would cut. You kind of listed the programs that you would cut, but you didn't actually show it in your budget, which is something we wanted to see. So I think you see the second budget actually being cheaper than the first budget, which is, as I said earlier, it's kind of the opposite of what we expected, because we usually want to see as much as possible is the requested fee staying the same, and then the expenses is the one that changes when we go from the first to second. So I don't know what the rest of the committee is feeling, but I feel that we could probably possibly approve the base budget, the first budget that they said fee, so the $85.20 and then $89.09 for the summer, and then work over the next 2 weeks to resolve the differences and come to something that we can all agree on. I don't know what is that.
I think I can see, just because there's been so many questions and things that people would like clarified, that I think that once we get that, and with maybe a little bit more time, we can get to a place and get a budget that is a little bit more clear for this committee, so that we can actually get to, like Brad said, a fee amount that is really what you all actually need to keep operating at the level of efficiency that you are currently. I know that personally, one of the things that I'd like to see is you kind of start touching on mandated increases briefly, but it's like less than a paragraph, and yeah, something like that to be increased, to basically to talk a little bit more about and get into kind of detail of what actually is increasing there, what's mandated, and then any increases that aren't mandated, and then showing that within the budget so we can see, okay, this is where a mandated increase actually comes from. This is an increase that comes from perhaps our staff, maybe that someone that's been around for a long time and says, hey, look, we really need this. And so then we can see the differences in where that budget is actually changing. And then we can also show the cuts or proposed cuts that you might want to make. That way we can really see the effect of the total budget if you had to make those cuts. We'll also see the effect on the budget of the mandated increases. That way, if there is an increase or if the fee stays the same, we understand why, because you have to pay for all these other things that weren't there last year. So if we could do that and just make that a little more clear, I think it'd be a lot easier for the board to take action on something like that.
So is any more discussion, or you can move? And I would recommend the first budget fee.
I move to tentatively approve the student health budget at $85.20 for fall, winter, and spring, and $89.09 for summer.
I second the motion.
Any discussion? Hearing none, we'll move to a roll call vote. Amelia?
4.
Tyler?
4.
Nick?
4.
Madison? 4 is Kara?
4.
All right, for a unanimous vote, that it passes. So the tentative SAH budget right now is at 8520 fall, winter, and spring, and 8909 in the summer. Again, just say that is tentative. We'll spend quite much time, I foresee, over these next 2 weeks to resolve the differences and create something that we can all agree on. The final budget, the SIC open hearing with the fees set for good is February 12th at 5 p.m. in the MU ballroom. But I'm sure we'll see each other more over the next 2 weeks. Yeah. So thank you for your presentation.
Can I ask a question of the committee before? We have one critical issue here, and that's that we have a physician retiring that we would like to advertise for, because the longer we put that off, the longer we're going to be without an expert physician. We're actually down 2 physicians, because I moved into the acting director, the interim director. So we're down 2 full-time positions until we hire this person. So I'm wondering how the committee would feel about us going ahead and advertising that.
I would say you should do what you want. Probably it's a good idea. You have plenty of working capital work on that too. It's really up to you what you want to do, but it seems really easy why not from my perspective.
Yeah. If that became an issue, we could always cancel.
Yeah, and I'm sure we'll resolve this.
Okay, I just want to make sure.
Yeah.
Well, you won't lose on valuable time as well to try and work on the hiring process, but. Thank you.
Oh, yeah, and,
I move to adjourn.
all right, acclamation.